Hi, I'm Kelly Ling, and today I'll be talking to you about leukemia, specifically acute lymphocytic leukemia, also known as ALL. What is leukemia? Leukemia literally means white blood and is a cancer of the bone marrow or blood. Leukemia causes an uncontrolled overproduction of your white blood cells. White blood cells are produced by the bone marrow and are the cells which typically fight infections. The overproduction of white blood cells crowds out red blood cells and platelets, stopping them from doing their jobs. Leukemia cells then lead to numerous problems, including anemia, infections, and possible death. What is leukemia? This is a picture of what leukemia might look like under a slide. Here you can see the red blood cells, and the purple stains right here are the lymphocytes. As the disease progresses, these lymphocytes will take over most of the area where the red blood cells would normally be. There are four main types of leukemia. They can be divided by the type of onset. There's acute, which is a quick onset and progression, mostly found in children under the age of 10 years old. Chronic, which is a slower onset and leads to many years of symptoms. This is mostly found in the older population. Then it can be divided into the type of cells affected. There are myelogenous white blood cells and the lymphocytic white blood cells. So the four main types are acute lymphocytic, acute myelogenous, chronic lymphocytic, and chronic myelogenous. Some facts about ALL. It is the most common type of cancer affecting children. It is the most successfully treated type of childhood leukemia. It most commonly occurs in children between the ages of 2 and 9, although adults are known to have this type as well. In 2011, out of the 44,600 leukemia cases diagnosed, 5,730 of those were ALL. As of today, there are no known causes specifically of leukemia, but there are risk factors. High levels of radiation, chemicals from chemotherapy. Many times there is secondary leukemia that people will develop after going through chemotherapy treatments for another type of cancer. Certain viruses, certain biological disorders. Down syndrome has been linked to leukemia, as well as Klinefelter syndrome. Race, it is more common in the Caucasian race. Gender, males, and identical twins. Typically when a person goes to the doctor, these might be some of the things that they present with. Fatigue is very common due to the loss of the red blood cells. Bone and joint pain or tenderness. And another specific symptom or sign of leukemia is the petechiae, which is the tiny pin-sized purple patches or spots on the skin. Although many people have no symptoms and the disease is only discovered during a routine blood test. The diagnosis. Doctors test for the following symptoms from the previous slide to determine the extent of illness and their treatment options. They will look at the number and the size of the leukemia cells, the type of lymphocyte affected, whether it's the B or the T cell, and the cytogenetics of the patient. Right here you can see a patient who is receiving chemotherapy, which is the typical treatment plan for almost all ALL patients. Radiation is used. It's normally only used with patients who have had the cancer affecting their central nervous system. And bone marrow transplant or cord blood transplant can be used on patients. It is very invasive, and they typically do not use it unless they think that the patient cannot go into remission through stronger chemotherapy treatments. The prognosis for patients with ALL, adults have a survival rate of around 40%, and children who successfully complete chemotherapy have an overall survival rate of 80%. So it is very, very successful for children, although not always. For all patients, relapse of leukemia is possible, and they will typically be treated with a higher dose of chemotherapy treatments. There are many resources out there for patients diagnosed with leukemia and their family members. These are just a few of the more popular ones: the Leukemia and Lymphoma Society, the National Children's Leukemia Foundation, and Leukemia Research Foundation. There are different colors that represent the different types of cancer, such as many of you probably know about breast cancer, and during the month of October you'll see a lot of pink ribbons. Leukemia is represented by the orange, and sometimes you will also see gold for any other childhood cancers. What have we learned about leukemia? What type of cells does acute lymphocytic leukemia cause the body to overproduce? Who is more likely to be diagnosed with ALL? Is it children or adults? Who is less likely to survive ALL, children or adults? What is one possible risk factor of ALL? How is ALL most often treated? Well, the answer to number one, the white blood cells are typically the type of cell, actually always the type of cell that are overproducing. Children are more often diagnosed, and adults are less likely to survive. Here you can see all the different possible risk factors. If you do not remember, radiation, chemicals, you may have wrote down male, Caucasian, identical twins, certain viruses, or certain biological disorders. And ALL is often treated with chemotherapy. These are some of the resources that were used during this presentation. And I hope you enjoy my presentation and learned a little bit about leukemia. Thank you.